Hi there, my name is Christina. I'm going to do a diabetic foot exam today on my person, or my foot. The first thing we're going to look at is your skin and your nails. The foot is warm, it is not cool, there's no ulcerations that we can see, any bruising, any cuts, any cracks. We do have a little bit of callus, but it's not anything that could drastically affect this person. We're going to look in between the toes for exactly the same thing. We also want to feel for the warmth in between the toes because that can be some vascular issues. We're also going to check for your pulses, which hers are nice and strong, +2. And we're going to check this one right here as well. And this one is also a +2 and very strong. We're going to also look for edema, which she doesn't have any edema. And we're also going to do a little bit of muscle strength. And she's got some good muscle strength. One of the tests that we're going to do is called the tuning fork. It's make sure that they have a vibratory sensation. Loss of sensation is a big thing with neuropathies, or it could be caused by, of course, diabetes, which has the hyperglycemia, which can cause microvascular complications. So we're going to have our person close her eyes and then tell me if she feels the sensation.
Yes.
Okay, and then do you not feel the sensation?
Stop.
Okay. We're also going to do the microfilament, and this determines also your sensations. We're going to put it on several places on the foot, and my person is going to tell me if she can feel them in different locations. And both of these have a really good sensitivity and specificity, greater than 80% to about 99%. So these are great tools to determine if we have sensation loss. I'm going to have you close your eyes and tell me where you can see where you can feel the sensation, okay?
Great toe.
Mm-hmm.
Middle.
Okay.
Pinky.
Okay.
Left top.
Okay.
Middle.
Okay.
Right.
And then sometimes you can do the heel if they don't have very many calluses.
I can feel it.
Okay. So the biggest thing with this is to determine, you want to look at ulcerations because calluses are a big thing that can cause hemorrhage, and they can cause necrosis, and which can create ulcers. You want to look at deformities. If they had deformities that caused an outward bow or places and areas like that, they can cause some ulcerations as well and can cause some decreased sensations. You want to look at, hairs on the toes if they have it. Of course, you check the pulses and warmth. And those things, again, are for vascular disease. Other things that we look at, we want to talk to our patient about foot care. You want to do daily foot care. You want to wash your feet. You want to check your feet daily. You want to tell them about proper shoes, which things that don't blister, cause redness, don't create cuts or rubbing or anything like that. And you also want to tell them that they need to do an annual comprehensive exam yearly. The only thing I did forget to check was a capillary refill. And if we do a capillary refill, and hopefully it's less than 2 seconds, then that is also a good predictive of good circulation. A lot of things, as we age or as we have complications with diabetes, you tend to have decreased oxygen flow to these areas, but she has a very good oxygen flow and nutritional flow down here. That is it.